Well, good afternoon everybody. I'm Andy Phillips. I'm the Regional Executive Officer at HSE Southwest, and I'm here today at Cork University Hospital. I'm really lucky to have Maria with me, who's a vaccinator for the hospital, and I'm going to be getting my COVID jabs and my flu jabs done. Now these are really important. We have over 4,000 people hospitalised every year due to flu. We have 7,000 people still hospitalised due to COVID. So it's really important that we get the vaccination done. Like many people, I have elderly relatives. I have a mother who's 89 and very frail, and the last thing I want to be doing is carrying flu or COVID to her, because I know in her state this would be really bad news for her. So I think vaccination is really important. So today it's my chance, my opportunity to get my free flu and COVID jabs, and Maria here is going to be doing this for me. Thank you very much, Maria. And I'm really encouraging all health workers to get their flu and COVID jabs done. We really need not to be spreading these viruses around the population. So here we go. Maria's going to do the vaccination, and I'll just let Maria get on with her work.
So just get your razor sleeve
Yeah. So Maria, you're giving me the flu vaccination in the right arm. In my dominant arm,
so
yeah.
Just get you to relax your arm.
Okay.
Just push across here. So that's it, all done.
Thank you, Maria. Completely painless. I can absolutely say that I felt no pain or discomfort at all. Thank you, Maria. Shall we have a go at the COVID jab now?
Sure.
Thanks very much, Maria. So into my left arm this time, my non-dominant arm. So again, completely painless. I know this is going to give me some good protection from COVID for some time, for the year. I'll just talk about some of the things that's been happening over the last little while in the health system. So colleagues will know that many other of the health regions, at least 4 of the other health regions, are moving to their IHA management structure. We have a few challenges in recruitment here in the Southwest, which we're going to be resolving fairly shortly, but it does mean that we're going to go live with the IHA management structure from the 5th of March rather than putting in an interim structure. So we're going to be working very well together, I think, over the next little while to put those structures in place, and I'll give you, of course, any update as soon as I can. So just in terms of other things that are happening, I was very pleased to go and visit the Youth Health Service a week or so ago. They provide free confidential advice for young people who need some advice on things like STIs and pregnancy, and need advice on family planning. And I was really impressed by the way that they do that. They're really quite good at the welcoming people. So obviously if you have some of these issues you want a conversation about, it can be rather embarrassing. They do it in a very non-judgmental, very compassionate way, which I think is extremely impressive. So I was impressed by the immediate contact with people where they are having a conversation about the services they provide, the fact that it was self-referral. You didn't need to go through a GP or a consultant to access the services, and a very high quality service. One of the other things I've done is to go to the mental health conference, which was on yesterday, and again very impressed with the partnership approach that we're taking. So lots of work going on in partnership, which I think is very impressive, with all of the community organisations, the voluntary organisations and the HSE services all working together, and I think that's really the way forward for us. The next thing I'd like to talk about is the Children's First Awareness Programme, which is starting on the 14th of October. So very important for us all who work in the health service, and we come into our contact with children in our working lives, that we're very careful about some of the signs that you can see from children who need safeguarding. And I've been in a number of countries where the safeguarding approach across partnership agencies hasn't worked well. There hasn't been good communication, but we know here in the HSE that we have a mandatory safeguarding course that you have to do once every 3 years. So I'd really encourage everybody to be aware of the Children First Awareness, which is starting on the 14th of October, and just to be very aware in all of your work about what we need to do to safeguard children. So I'd just like to say thank you again. Thank you very much for all the work you're doing. I'm here on site at CUH at least 1 day a week with other colleagues in the team, and going around working with people. I know it's been an extremely busy time for unscheduled care, and we're really trying to make the system as good as we can before an even busier period comes along in winter. So thank you very much. I'll be around and coming to see you where you work. Look forward to the opportunity to talk to you soon. Go out and get your flu jabs, go out and get your COVID jabs. Really important that we also keep infections at bay by bare below the elbows and washing our hands. Thank you again.